Bispecific T-cell engaging antibodies have emerged as a promising option for patients with relapsed or refractory large B-cell lymphoma. There has been increasing interest in determining the real-world outcomes for these agents. So our study was a multi-institutional retrospective cohort from over 20 different centers in the United States that analyzed the outcomes of patients in this population treated with these agents as part of the standard of care. So we were able to ascertain 208 patients between the beginning of 2023 to October of this year that were treated with either Epcoritamab or Glofitamab as part of standard of care for relapsed aggressive B-cell lymphoma. The median age of our population was about 68 years, and on average, patients treated with Epcoritamab were significantly older by about 5 years compared to those treated with Glofitamab. Most of the patients in our population had diffuse large B-cell lymphoma not otherwise specified, but we did have a significant fraction of individuals who had high-grade B-cell lymphoma or double-hit lymphoma, which was about 18% of our whole population. Patients generally had more comorbidities compared to individuals that were treated with these agents in registrational trials. And in fact, about 70% of our population would have been excluded based on the exclusion criteria that are available from those studies. The overall response rates to the agents in our entire cohort was about 53%, with about 26% achieving a complete response and about 27% achieving a partial response. We found that for the responders, the duration of responses were encouragingly maintained over time. The progression-free and overall survival of these agents was relatively short. That is in keeping with the multiply refractory nature of the treatments that these patients have received. Toxicities were the highest with cytokine release syndrome, with overall in the cohort that occurred in about 50% or so. Most events were grade 1 to grade 2, but we did see a handful of patients, around 3, that had grade 5 events due to cytokine release syndrome. ICANS was even less common, but there was one grade 5 event that was reported with this toxicity. So overall, these agents are a promising option for the treatment of patients who have otherwise very difficult to treat disease. We found that overall, like many real-world studies, the population that we included had more comorbidities and was potentially influenced the outcomes based on those findings.